All right, welcome to the Big Texas Podcast presented by Texas Young Republicans. I'm your host, Jordan Overturf, bringing to you another candidate on the road to November 3rd, 2020. We have 167 days until Election Day. It's time for Republicans across the state to rise up, get active. We've got state convention coming in July. We've got a runoff election July 14th that will finalize the ticket and let candidates across the state know who will be on the ballot for the general election in November. One of those folks who will for sure be on the ballot is Dr. John Guerra. He is my guest today, joining me from House District 41. Dr. Guerra, thank you so much for joining us. My first question for you is, how are you and your family managing during this coronavirus response?
Well, for me, it hasn't been that bad, okay? I'm an obstetrician gynecologist, so I still have to get up early, go to the hospital. I still have to see patients in the office. Of course, it's just my wife and myself now. My two sons have their own lives. But basically, I haven't had to endure such shelter in as many of the other constituents or people here in the state of Texas. And so what is it like? Still just getting up, coming to the office, making sure that we're taking care of patients, and then getting home and trying to do what they've asked us to. But after 8 weeks, hibernating just doesn't apply to Texans, okay?
Yeah, staying indoors is not part of our mantra at all.
No, cabin fever is bad. Bad, bad, bad.
Well, we at least got some good news from the governor this week that things are going to be opening up. Before we get too far into this interview, what do you make of the governor's announcement this week? And from a medical perspective, do you feel like it's a prudent decision?
I still feel that it is a prudent position. We can move forward, okay? What I've been trying to tell people or educate people about this is that the coronavirus is going to be with us, okay, until we get a full cure on it. And so what we've had to do was just limit the curve, or how many patients would be able to go to the emergency room or to a hospital and overwhelm the hospital, or basically the intensive care unit, or the amount of hospital personnel that are there. Okay. Mm-hmm. I've kind of told people that you have to walk through the tunnel. It's going to affect each and every person individually. And what we have to do is we have to take care of those that are vulnerable or have a lot of health care issues. And so that's what we have to do. But outside of that, I believe that we will do very, very well with the blessings of God.
Amen. And I know that our prayer warriors have been out there this entire time, lifting up elected officials, all the essential care workers, the frontline responders, everyone. So we're thankful for those prayers, and we're going to need them to continue as we make the march to November. Speaking of House District 41, that's the race that you're running in down there. Can you tell us a little bit about the district and kind of what got you into this race?
Okay. Well, House District 41 came about probably around 10 years ago, or a little bit more back when the census was there. And it encompasses the cities of McAllen, a little bit of Mission, Palmhurst, Alton, the lower part of Edinburgh, a little bit of Farr, and the majority of McAllen. And so this is a district that is right in the middle of other districts around us, okay? But this is mostly like what you would call a urban or really metropolitan district, okay? And so it's about a lot of constituents that are fairly educated, well off, have businesses, go to work every day. And so we feel it's a very conservative district here. The problem with it is that it has been governed by the Blue Party or the Liberal Party for the majority of the time. And so those of us that are conservative feel that we haven't had a voice up in Austin that represents us. And as this constituency grows in conservative people, we feel that this district should be a red district, conservative Republican district.
Yeah, I know the Hidalgo YRs are down there. They're active. They've got a huge following down there. Are you seeing a shift to more conservatives or more Texans in that district start to voice their opinion about conservative issues, starting to push back on the leadership that has been down there for so long?
Oh, yes. Yes. And we feel that we just haven't been represented at the level of the legislature up in Austin. And so we as conservative, red, Republican, feel that we haven't had that voice or are receiving that voice. And so we feel that with me coming up there and being elected, we're going to have that voice right there at the table, that we'll be able to sit at that table and we can make a difference. Because really, if you've had the same thing for such a long time, why do you want to continue down that same road? Let's try something different. There's more populace here that is conservative, wanting to go in that direction. And so as long as we can educate the electoral or the constituents, I think that this is going to make a big difference up in Austin. I think we've been overlooked for quite a bit time here in the Rio Grande Valley because we've been blue since I was born. Okay.
Well, let's get into that. So for those who don't know your background, obviously you've talked about your medical expertise, but just give us a quick look at your background and experience and, what the steps were that brought you into this race.
So basically, I was born and bred here in McAllen, Texas, the lower Rio Grande Valley. I went to school here. I went to Pan American University, which is now UTRGV, graduated from there. I then went on to University of Houston to get a degree in pharmacy. But during that time, I was accepted to medical school, which I really wanted to do. And so I went to the Doctor of Osteopathy, Texas College of Osteopathic Medicine in Fort Worth. I did my medical osteopathy degree there and then moved to Phoenix, Arizona, where I did my internship and residency in obstetrics and gynecology. From there, I did my first year with public health. I helped the Indian nation, and I did public health my very first year. And so I got a little bit of an experience through the government at that time. From there, I went out into public or private practice, but both my wife and I were from Texas. And as it said, you can take the boy out of Texas, but you can't take the Texas out of the boy. So we wanted to come back to Texas. And so by way of coming back to San Antonio and then here to Mission, I opened up a practice. I've been practicing obstetrics and gynecology for 25 years. Here in the Valley, 20 years. We've helped our parents. Both of mine have deceased. My father-in-law has deceased. My mom, or my wife's mom, is still around, and she's elderly, and we have to take care of her. And so we've come back that way. I've been a member of many of the associations, the American Osteopathic Association, the Texas Osteopathic Medical Association, the American College of Osteopathic Obstetricians, Gynecologists. I belong to the Catholic Medical Association. I'm presently the medical director of the McAllen Pregnancy Center, which is an alternative to abortions. I'm presently the chairman of the Department of Obstetrics and Gynecology at Rio Grande Regional Hospital. And last of all, a couple of appointments that I've had. One was with Governor Perry to the Texas Medical Board. I was there for 4 years. Before that, I was on their review committee, so I know how boards work, how legislation is done up in Austin. That has kind of led me to pursue this at this time. And last of all, I was the vice chairman of the City of Mission Planning and Zoning. So I know how some of the local government also works. So this is my background, my experience. And basically, I was pushed into this, not to try to make this long, but many people would tell me, well, you're always criticizing, you're always saying this, that. So why don't you do something about it? And so finally, I did decide, yes, it's time to do and to be proactive in this, because many people just don't want to do politics. There's this stigma of politics being dirty. And I don't believe it's dirty. I think that the perception is there because those people that have been in politics have made it a career, have made it something that is there for them and not for the constituents. And I feel that that's where people are butting heads mostly. So that's what's gotten me into this race. And I feel that I'm the right person to make a change here in House District 41.
Now, I don't like to bring up opponents too often because I want this to be so much focused on you, the candidate, right? And allowing voters to get to know you. But your race presents a little bit of an interesting dynamic, to say the least. We've got Dr. John Guerra taking on attorney Bobby Guerra. Right.
Correct.
And so I have to ask, as you were strategizing this out, anytime you talk to a political consultant, name factor always comes in there, right? Is it a good name?
Yes,
will people follow it on the ballot? For you, Guerra versus Guerra, doctor versus attorney. Did any of that play into your strategy?
Yeah, some of that did. But Bobby, the incumbent, had said that he wasn't going to run again. And so when all of a sudden he did, and we're probably somewhere related way, way back, okay? But yes, that came into the strategy. We felt that Guerra versus Guerra. And I think that the big thing that's going to make the difference is that I'm a physician, okay? I'm not a politician. I'm not a lawyer. I, as a physician, was trained to diagnose, manage, and treat illnesses. And so my job, I feel, is to go up to Austin, find those problems, address them, and get them taken care of, and to get out of there. It's not a lifelong job, I believe, as I've said. And so I believe in term limits to a certain point. And so, yes, I want to use this. But I want people to know that as a doctor, I feel that I will be providing something that isn't being provided at the level of the legislature. There's only about 6 physicians that represent the rest of physicians or other professions up there. I really think that we need maybe, accountants up there. We need lawyers, of course. We need doctors. We need realtors, maybe some developers, businessmen, because the more different professions that are available, I think that that's better for the state of Texas instead of all of these lawyers, unfortunately.
Yeah, I'd be curious to think what the citizens think about, a lawyer-controlled legislature, whether they'd be more effective or less effective arguing it out. So let's get back to you and your specific policies. Before we get into kind of the issues that really drove you into this race, I want to talk about voters right now as they are watching what is happening across the country, various very different leadership styles in terms of Republicans and Democrats. For you, what do you think are the issues that should be at the front of voters' minds right now?
The biggest thing is coming out of this coronavirus is going to be very, very important, okay? And so let's talk about the state of Texas, really important there. We've always applied the importance to gas and oil as what is our economy mostly for the state of Texas, because all of those monies then trickle down into education, okay? And so everything is kind of put together in this manner. And so one of the biggest issues that I think that we're going to have to really legislate and help is the oil and gas industry, because off of them, everything kind of comes from that. And so we're going to have to help that to help our economy. That, of course, will then help small businesses, which we want to help, because most of small businesses employ more people out there. And so one thing leads into the other. And that's why I really want to try to work in reducing the regulations. As President Trump did, he reduced a lot of the regulations in trying to get PPE out there or protection, because there's so many different little things that go on. So from the healthcare field, you know, we have this big thing where we talk about a certificate of need, which is regulations, okay? If we didn't have so many of those regulations, then we would have more accessibility to a lot of things that we need to be able to get done. It's the word, it's can't, but why can't we do that, okay? It's about getting the thing or the job done. And so I really want to focus on small business, education, gas and oil, healthcare, accessibility. Those things are really the important parts of my campaign and what I am now seeing that we need to help Texas with.
Now, obviously, this district being right there in the Rio Grande Valley has made it kind of a target for national issues. Immigration, obviously, at the top of that. But a lot of the discussion that you hear in the legislature when you're working in Austin is about, health in the Rio Grande Valley and making sure that that population is being properly served. From your perspective, what are some of the small changes that can be made either from a policy standpoint or, from an agency management position to improve health for the folks there along the border?
Okay. Well, yeah, that's one of my forefronts. As you know, the incumbent tried to pass legislation here in Hidalgo County, 2 times increasing taxes by trying to get a hospital district. And the voters turned that down tremendously. So we know that they wanted to put more taxes on the burden of the taxpayers. We didn't want that. We, of course, don't want that. So how are we going to affect this? Well, a lot of people here in Hidalgo County or House District 41, there's a lot of Medicaid. A lot of patients are on Medicaid. We know that we didn't proceed on the federal level that we get all of the monies that we necessarily deserve, okay, for the whole state of Texas. And so you're going to get a push from the Blue Party that we need more Medicaid, which then increases more taxes here. I feel that we can go about this in a different manner of trying to legislate the availability of using the whole state to get better Medicaid monies. Here in District 41, you have the Medicaid and the people that have insurance, and then you have this small part or medium part of people that don't have any insurance at all. Those are the ones that have a job, but for instance, need an appendectomy, need a surgery, a hysterectomy, from my point of view, that they have to quit their job because they make too much to get on Medicaid, but don't make enough to have good insurance. And so they fall in the middle. And we really need to be able to try to work on that middle area in healthcare to help these people so they don't have to stop their job to get on Medicaid, which then is government assistance, and then it hurts everybody. While at the same time, you would try to make, or they would have enough there to be able to buy some good insurance. And being a physician, I think that we can come up with those right attitudes or the right policies that will help these people be able to have the accessibility and or also be able to just procure some type of insurance. And then everybody will be well because the doctor gets paid. You know, you don't have to worry about a big bill by the patient from the hospital being billed for surgery that they need. And so this is where we really need to work on. And, you know, my incumbent, he's on that, the public health. I don't feel that they've done very much on this area up in Austin.
Yeah, I know that the Texas A&M Health Science Center has been working to create initiatives, specifically managing more, preventative care, healthy lifestyles, encouraging better nutrition and things like that, that will curb a lot of the health issues that folks in the Valley end up dealing with, either being, through their genetics or through just the lifestyle of how rough it is, depending on what kind of job you're working down there. But at the same time, a big focus, and we just saw a letter come out from the governor today saying that state agencies across the board need to prepare for a 5% cut in their budgets. So this is a clear indication that the legislature in January 2021 will be facing a budget deficit from the previous biennium. For you, as a conservative, as you look at the budget obstacles that are ahead, where are some areas that you think we can begin to start making those cuts?
Well, unfortunately, this is where we're going to really have to bite the bullet, okay? And with coming off of this coronavirus, even worse. So one of the things that we're going to need to look at is new hiring of government employees or in the agencies. That will have to be limited or basically completely frozen, okay? We'll also probably have to freeze any salaries. People always want an increase in their paychecks, but that probably will have to be frozen. We may need to postpone certain projects that may be out there that need to be evaluated. We may have to consolidate more agencies. An example is previously the Texas Medical Board used to take care of the physicians. Well, they now take in the respiratory, the medical, radiology, the physician's assistants. And so all of these have been combined. So that will probably have to help with consolidating other agencies. We would look at that. And then we have to look at anything that we can hopefully reduce the duplication of services out there. Because sometimes there's a lot of duplication of services. And then last of all, because money goes into the general fund, we're going to have to monitor how we spend that money. And so those would be the things that I would be looking at as the next representative from House District 41 on how we're going to have to budget everything. And then look at oil and gas as the economy comes back and the small business help to bring back the economy that Texas was having.
Absolutely. I want to go back to something you mentioned there. Can you give any specifics on duplicative services that are being received by Texans?
Well, I I would really have to go and investigate that. But when you have certain agencies, there's probably some duplication that goes on in there. Um, and it may be more work, but uh, when we did there on the medical board, when you bring these people or different agencies in, you may not need all of those administrators there because you already have one administrative body. Okay, yes, it becomes a little bit more work, but possibly and unfortunately, some people may get a pink slip, but you would be able to reduce those duplications. Okay, maybe I know that there's a lot of lawyers there in Austin, but some of them would not need to be on all of these agencies, possibly. You may not need all of the secretaries or other people there. You would be able to take a look at those things and, combine the efficiency of these agencies.
Yeah,
Okay?
I don't think anyone would argue with the attempt to make government more efficient. And I think the bigger argument that we've seen, certainly in this coronavirus response, is the tragedy of government being the result of those jobs going away. Right, the loss of jobs.
Yes, correct.
Under crushing
Correct.
regulations, or the shutdown orders and things like that have put specific businesses, not industries at the whole, but specific businesses in a tough spot. As we get ready to open up and we evaluate this response, who do you think has been hurt most by the coronavirus response?
When I look at it, I think everybody's been hurt. Okay, but when I look at it from a medical point of view, the elderly, the people that have had problems with metabolic syndrome, other problems, hypertension, diabetes, obesity, people in nursing homes. I feel those are the ones that have been hurt the worst. Okay. Following that, small business has, because that's everybody out there working. They've had to shut down their business. That's their full income. So those have been the ones that have really, really, really been hurt tremendously. Then you have just the routine family people, okay, or the families that have had to stay at home, sheltered in. And we know from a medical point of view, psychologically and depression, these things have increased quite a bit. And so we're going to have these problems. Yes, everybody's been affected, but I believe the elderly, the small businesses, and just the regular family itself have become what I call a terrible falling out of this coronavirus.
Yeah, the unintended consequences of shutting everything down and forcing people to stay at home is certainly going to be felt for a while. As you look at the response, have any policy ideas come to mind on how we can better protect Texans from future pandemics?
Yes, I thought about some of those as, we've been able to have more time available to us. So what I thought about how we would do if there was another pandemic, or even, we have, Texas is such a great big state. You may have tornadoes up on the northern part of the state while we have hurricanes and flooding more towards the coastal areas. Okay. Mm-hmm. So my considerations would be that you would pretty much divide the state into 4 quadrants. Each one of those quadrants would maybe have an agency that would be made up of whatever you needed, food, stocking, instrumentation. For example, just using this pandemic, ventilators, PPE, food. Uh, what other thing? Maybe dialysis machines. Nobody has thought about that. What if this pandemic would have really hit people in the kidneys, okay? And you needed, dialysis machines instead of ventilators. Mm-hmm. Well, you have to have these things. And so in the 4 areas of the state, you may have this agency or availability for quick response, okay? Even with food. It would have to be monitored appropriately so that if you did buy things, and learning from New York, that they don't just get left there on the shelf and then they're not valuable to us anymore. So that would have to be. If we were talking about a healthcare issue, I would consider that the governor would appoint, non-paying, but an appointment of a committee of physicians that would come together and would address, the diagnosis, management, and treatment of whatever it was, and lead the state, just like he asked all these business leaders and people to come out as the opening function of the state. Well, these doctors would be able to help lead the state and address the problems that are needed there. And so that way you would have this available for the government agencies, that you have the best people available to give them best information.
Now, people, obviously, our news cycle goes so quickly and there's always something new to distract us. But something I was thinking about this week was in 2015, when we had the Ebola outbreak coming from Africa, it seemed like that, obviously, Ebola is a much more terrifying disease in terms of the costs that the effects it has on someone who catches that. But why does it feel like these were 2 vastly different responses in terms of how we managed Ebola versus how we managed coronavirus? And from your perspective, did we learn anything from 2015 that was applied to this? Or is this, because this disease is completely different, came from a completely different part of the world, do we have to be more nimble in terms of our responses?
Well, yes. And number one would be that the Ebola affected people differently. It was more on the vasculitis side, and I'm using medical terms here, versus what we have, a respiratory disease that is easy transmittable, okay? And we'll use the flu as the example. If you're coughing, eating, things like that, then the particles can be put out into the air, and it's easier to communicate this disease than really what was the Ebola. The Ebola was very close natured. It was transmitted from one person to another, but it had to be more through a specimen, okay? Body fluids, other things like that, okay, versus airborne. But what we would still need to do is that I think the government overreacted, in my perspective, only because of what was going on in the other countries, okay? And I feel that President Trump did an extremely great job by cutting off travel from China early on, et cetera. People can take a different attitude on this, but in this pandemic, it was totally different. But I think each and every governor really got really scared and what was going to happen. And basically, we didn't know. Sometimes it's better to hibernate, or look what we did. But I think this pandemic is really going to lead us in the future, because this is really the one that has affected us completely, okay? And I think in the future, we really need to have the right expertise to lead us. Okay, this has really hurt this whole country across, even with the state of Texas. But it's because we really didn't know enough, even from the doctor's point of view. But I think this will really lead us into the future, that we don't have to be so conservative in the nature of how we have to do this, okay? But we learn something from everything, okay? And that's why we have to have the right people up in government to be able to make these decisions, okay? And these are life and death decisions that we made for everything, whether it's a small business or whether it was just for a person.
Yeah, and speaking of the future, November 3rd, 167 days away, Dr. Guerra. What are you doing? Yes, I do keep count. That's how much I love politics and how closely I monitor everything going on. But so for you yourself, 167 days, what is getting you excited about the campaign right now?
Number one is that, we started my campaign back in July, so we've continued. Yes, we did have to hibernate during these months, but what we've been doing is we've been using social media, and I do Taco Tuesdays every Tuesday. We go to a small business. When we were isolated here, we would still go get the tacos from one of the businesses, and we've continued to try to educate the constituents of House District 41, why I should be the next representative up in Austin. So what I really look at this is that the voters need to start looking at who's representing them. Is that person representing the constituents of that district, or are they representing themselves and their ambitions? Okay. And so I think that that's what's going to come out of this, okay? In that, I am going to be very proactive. I want to work with small business. I want to work with education. I want to work with the school districts. I want to work with everybody, just like I've always done. I feel that I'm just a regular type of guy. Yes, a physician, but I get along with everybody. I talk with you. I don't feel that I walk, 10 steps above you, okay? And I try to educate everybody at the same level, at the bottom level, so that you know what's going on there. And so I really feel that that's what I bring to the table versus my incumbent.
Well, I thank you so much for taking the time, especially as everything is crazy. We know we're on the other side of this or moving towards it very quickly. But I appreciate you taking the time. For people who want to learn more about your campaign, where is the best place for them to do that? Go ahead and give us your website, social media links, all that stuff.
Yeah, it's votedrguerra.com is where most everything is there. We are on Twitter. You can still find me right there. And, if you really want to, I've always had my telephone, and it's always open to anybody to answer questions, including my patients, and I do answer that. And so area code 956-212-3714 is my telephone number, and I'm always willing to talk to you. You can go online and take a look, and you can see what we're standing for.
Excellent. Well, I appreciate you taking the time with us, Dr. Guerra. We wish you all the best of luck in November. If we get a chance, we'll certainly bring you back on. As we wrap up here, have there been any fun moments for you or your family during this response? What's something that a positive experience that you have had during this that you're going to carry forward with you?
The biggest thing is that I learned how to use social media much more, okay? I was, I'm a little bit older. It's a lot more difficult for us older people to use social media, but learning the aspects of what, the young millennial people are out there, that is something that's been really, really has moved me to be able to use my telephone, my social media, everything else, or IT basically, to get things done. Okay. I don't like that. I come from the era of person to person, and I want to keep that part. But I have learned how to use my telephone much, much more than just talking on it.
Yes, we have all had to adjust and adapt, and it's real funny to see the things that have sold out so quickly. Webcams being at the top of the list, you have to back order them at this point. So if you're in the Zoom industry, I guess it's good business for you right now. Dr. Guerra, thank you again. We wish you the best of luck, and we'll see you down the road, okay?
Yes, sir. Thank you, and nice meeting you.
All right. Thank you again to Dr. Guerra for joining us. Thank you to you for tuning in. Lots to get to as we make our way to November 3rd, 2020, the general election. We have the runoff elections on July 14th. So this is another call to any candidates who are out there and you are in that July 14th runoff. If you want to talk to voters directly and let them know what your positions are, what is your policy? What do you make of this response? How would you lead differently? Give us a shout out on on Twitter, Instagram, wherever you want to find us at Big Texas Podcast. You can also reach out to the Texas Young Republicans on Facebook, Twitter, and Instagram at Texas YRs. And we've got so much planned for this cycle. If you are a young Republican and you want to be part of the effort to keep Texas red in 2020, I'm going to need you to go to our website, texasyr.gop. Make sure you enter your email so you get our newsletters and alerts, so that way you know when our deployments are going to be going on, when we've got days of action, making phone calls in targeted races. Democrats are fired up. They have been holding Zoom calls throughout this entire coronavirus response, plotting and planning the way they hope to flip the Texas House. And that needs to be a primary focus for Republicans in Texas this cycle, is to make sure that we support our candidates. We've got 83 candidates that are, 83 representatives currently serving in the Texas House, 83 Republicans who want to go back and fight for a number of issues. This session is going to be more important than ever. Now we are looking at not only redistricting, we are looking at a tough budget cycle. We are going to be looking at the implementation of new policies to protect us from future pandemics. If you want to see things change and you want to see stronger, more conservative leadership, then you need to make sure you get informed. Again, sign up for our newsletters and alerts. TexasYR.gop is the website. Again, follow us on Facebook, Twitter, and Instagram at TexasYRs. Thank you so much for listening, tuning in. You can get this podcast on Facebook, YouTube, or you can download the audio on iTunes, Spotify, Google Podcasts. We unfortunately don't have a special deal from Spotify. We are not exclusive. We are happy to get this out to as many people as possible. Thank you. Thank you. Until next time, friends, see you down the road.